Let's talk about EMS and blood products. Blood products are the belle of the EMS ball right now. Everyone is talking about blood products. No one is talking about ketamine. How do outcomes compare between the different types of blood products? We have a paper we can look at, an ESO paper, that compared outcomes between patients who were administered whole blood or blood components being platelets, packed red blood cells or PRBCs, and plasma. ESO data was collected from a 4-year period for patients ranging from 8 years old to 100 years old who received blood products by EMS in the field, almost 2,000 patients. Administration favored whole blood, with about 1,500 patients receiving whole blood and about 500 patients receiving blood components. Whole blood was used more often by ground services, urban services, and in penetrating trauma. There were two outcomes with this paper. They were first looking at changes in shock index vital signs and Glasgow Coma Scale in the field, and then they were looking at mortality in the ED. They did notice some changes in shock index and heart rate that favored whole blood, but mortality in the ED was unchanged between the two, making those differences in shock index and heart rate of questionable significance. There were also no differences in anaphylaxis or transfusion reactions. Carrying whole blood can present with some significant logistical challenges for EMS, and this paper goes a long way to demonstrate that it can be more feasible to start with blood components. I'll post a link to this paper in my bio.